I would like to tell you a true story about a close friend of mine called KK. KK was the kind of guy that everyone loved. He was great at sport, he was an A student, and all the girls loved him. And because of that, I was a bit jealous. But he had something about him that inspired me and that brought me close to him. He had what we all thought was a spark, something about leadership, something that we thought, this guy will be the next president of Ghana. And because of that, I wanted to get closer to him because I thought I wanted to know the next president of Ghana. KK won a scholarship and went to the college in the US. And one holiday, he came back home to visit his family. But then he became ill, and then he went to a hospital. And when he was there, he was treated for malaria. But that was the end, and as he started to deteriorate, that story did not change. So he went to another hospital, and he deteriorated even more, until he was finally transferred to the main teaching hospital in Accra. When he arrived, there were long waiting times, and so he was not seen until he became unconscious. But by that time, it was too late. KK died, and at that point, all his friends around the world just felt an enormous loss, not just in their friend, but in the prospect of having someone who would make an impact in life. And for so many of us, I believe that we have, in one circumstance or the other, whether through a family member or whether through ourselves, we have been at the receiving end of a failure in the healthcare system. I want to just take you to America, where quality healthcare is a standard. And in America, what you see is that preventable death accounts for about 400,000 people per year. Now, what does 400,000 people mean? 400,000 people is the population of Miami or any other great city around the world. And in Ghana, the problem is that we do not measure and we don't know exactly how many people die from preventable causes. And that is a problem because when you add communicable disease, such as malaria or cholera, that accounts for about 51% of all disease and all death in Ghana currently. There's a picture behind me that shows a stereotype, and I know that healthcare in Ghana is not representative by that picture. But for an unacceptable number of people, that picture is still a reality. And something has to be done. When you think about our healthcare infrastructure, we can't solve all these problems. But there is a new phenomenon, and that is that of non-communicable disease. I'm talking about things like heart attacks, stroke caused by hypertension or diabetes. Currently, that percentage of death is 42%, but that is going to continue to rise as we continue to develop and we start eating and living life in a very different way than we used to. By 2030, the majority of all death will come from non-communicable disease. Now, I just want to say all of this because I want to reflect it back on us. Why should we care? 1 in 5 of us who are gathered here will die prematurely because of non-communicable death. And when you add communicable death and when you add preventable deaths, that statistic is more. And there is a challenge because ill health equates to poverty. There is a vicious cycle that goes on because the more you spend on healthcare, the more you're taken away from business and from providing for your family, the more deeper you get into poverty. And for us in this region, that is a challenge that we have to address. I am privileged to be standing in front of you because of my own personal story and how I came to move back to Ghana. In 2009, I was working as a medical doctor near Liverpool in a children's hospital, and I became ill. I thought it was nothing, so I just went home. But when I was at home, I had a deep, crushing central chest pain, and I started to wonder whether this was something I should worry about or I shouldn't. But by the time I was on the floor, I had to call for an ambulance. Within 10 minutes, an ambulance came by my door and had with it everything I needed, everything they needed to make a diagnosis. I was having a heart attack. Because of where I was routed to the Liverpool Heart and Chest Hospital, which is a super specialty hospital in Liverpool. And within an hour, I was seen by a top cardiologist. I was treated and diagnosed. And I survived. That night, I realized that quality healthcare is not just fancy equipment or shiny new buildings. Quality healthcare is compassion and empathy. Because whilst I was alone in the high dependency unit, a nurse who I didn't know came by my side and put her hand on my shoulder. And at that moment, I felt so scared, but I also felt hope. I saw my life flash before my eyes, and I thought, what have I accomplished in this world? I have not done half the things I want to do. I have not made the impact I want to make. And so I started to reflect on what I'd done all this time, and I started to change my mindset. The next day, a cardiologist and his team came round, and they told me that I had a diagnosis that was the same as the person who is shown on the screen. His name was Fabrice Muamba. He was a football player, and in a live televised show, a football match between Bolton and Tottenham, he dropped dead. His heart stopped beating, and for 78 minutes, he was resuscitated and treated, and his heart came back. Now, for so many people with that diagnosis, that was a rare occurrence. But because of where he was in the world, because of who was around him at that time, he survived. And the reality for all of us is that we can cross the street, and at any point in time, we can be hit by a car and we can die. Our humanity has to come in front of our eyes for us to realize that we only have a set amount of time. But what do we do with it? And why should we care about healthcare? I don't want to be morbid by telling you all about these statistics, but all I want to do is to get your mind engaged to the fact that healthcare matters and we all have a part to play. So I would like to suggest 3 things that you can do. And the first is to believe in better. Now, I get a bit irritated when people, exasperated by Ghana, the troubles that they see, say, this is Ghana. And for me, I'm just thinking, are you saying that Ghana has no hope? Are you saying that we can't change? And all around me, I see evidence of change. I see a man called Bill Gates who was in his garage and believed that every household would have a computer. And currently, I see that in the remotest places around the world. And in Africa, where we have challenges with money and how to transfer money, I see how mobile technology has advanced solutions for these problems through mobile money. So we can make a difference and we can change. But it starts with a mindset. It starts with us rethinking what we believe. But it takes one step, because I'm also not trying to say that this is a problem that will just go away like that. It is going to take a long time, and it's going to take a lot of work. But each of us have in our hands a seed that we can plant, and that can begin to grow. Each one of us has one step we can take. For the entrepreneurs who have spoken so eloquently on this stage, and for all of us who've been listening, those entrepreneurs who can come up with solutions for problems have a part to play. In the IT sector, you have a part to play. In the finance sector, we need people who have the know-how to make transparency and accountability a reality in every hospital, such that a hospital can be sustainable, so that they can make profit, and that profit can go back into the organization to invest in more healthcare. But for all of us who are seated here, who might not yet know exactly where we fit, we all have a part to play. By holding our government accountable, by holding doctors and nurses accountable, we all have a voice, and we can all use that voice. But the last thing is that we can't work alone, and we can't work in silos. We need to work together. Now, I'm excited by being here because I can see so many people from different sectors, and the government cannot do it by itself, neither can the private sector. And we all need to, in the healthcare industry, need to start looking to other industries to learn what is best practice in the airplane industry, what is best practice in other industries where safety matters. I am privileged and humbled to be leading an organization that was founded on the premise of teamwork. My father started Nyaho Medical Centre and believed that by working together, we could create quality healthcare in Ghana. And I believe this because I have a personal story where I saw this in action. Behind me is a picture of my daughter, and she is the joy of my life. I see in her the reason why I'm doing what I'm doing. But she was born in the hospital that I worked for, and whilst my wife was in labor, there were complications. And I was scared, but I saw an obstetrician working with a midwife and a pediatrician working with the anesthetist. And the next day, in our midst of confusion, a pediatric cardiologist came and diagnosed her and gave us reassurance. And this was all in Ghana, and I was so privileged to see this in action, but as a father, I was so thankful. But this is not the reality for many people in Ghana and around Africa. And I realized that I am one of a privileged few. If Ava grows up and she goes anywhere around Ghana, doesn't matter who she is, because of where she is and who's around her, she can either live or die. And that is why I am here today to say that we all need to believe in better. We can change, but we all have to think about what one step do we take. And lastly, we need to work together. Thank you very much.